So my name is Rui Amaral Mendes. I'm a professor at the medical school of the University of Porto. Well, basically, I think that we are now on the verge or we should be on the verge of a major paradigm shift. If we want to make personalized medicine, if we want to embed personalized medicine into the European Healthcare Union, we need to change how we organize things. And one of the major changes that I see, and one of my take-home messages, is that we definitely need to put the patient in the center of what we do. And by putting the patient in the center, I mean not just get them involved in later stages, but actually get them involved not in the inception of projects, not in the inception of research, but from conception point. So they really need to be, we need to answer, we need to address the questions, the demands of the patients, rather than just delivering things that may not actually be or rely at the center of their concerns.
Thank you.
I think that's central. If we learn something from COVID, is that we live in a global village, and diseases they know no borders. And also, if we look at what's happening in like the global migration that are occurring, so we can no longer think about healthcare problems as something that this is European, this is North American, or this is African. People move around, and we need to. The only way we can address these demographic changes in a truly impactful way is if we consider the world as a whole. And in addition to that, we always hear this call for multi-centric studies, and that's where the evidence comes from, and so that only adds to the need for these international collaborations, because that's what will provide power to the studies, and it will also maximize the resources in a world that often deals with economic the economic conundrums of allocating resources. I think that this may also be an opportunity to address those economical aspects of carrying out research and providing healthcare. Okay, so as I mentioned in the beginning, so I think that we need to place the patient, we need to involve the patients, not from inception, but from conception. So that would be one of the things. They need to be real partners through the entire process. We need also to have an holistic vision of the patient also. And that means considering the entire clinical pathway and the entire patient journey. So not just, we shouldn't regard healthcare just as the curative aspects. We need to consider the preventive aspects. We need to consider the palliative care. We need to consider, for example, in cancer, supportive care in cancer. So we need to consider the entire journey of the patient. And the other thing is, in order to provide scale to these approaches, I think I often hear the term centers of excellence. I think we need to evolve to something that I like to call comprehensive excellence hubs, and that means getting different stakeholders on board, and we also often hear about the need to engage in interdisciplinary and multidisciplinary approaches. Obviously that's important, but we need to create comprehensive excellence hubs where we actually gather like the academia, the clinical, the healthcare setting, the research setting, but also the economic, the industrial setting. And on this note, I think it's also important to rethink the business model. I think one of the reasons why often these new approaches and these terms, they often fail when we try to translate it to real world, is that we are using the same methods and for different questions, and we expect different answers, and that's not going to happen. So in terms of business models, obviously that public-private partnerships should be addressed, and I think that they can also be part of the solution in addition to public funding, but also consider the entrepreneurial spirit, and promote social ventures, promote impact in startups, which may actually be another way of actually providing the financial resources that are so needed to make this reality to materialize.